Pellevé, fat melting. Dear Doctor, first of all, I am sorry for my English. I live out of USA. I've had Pellevé treatment yesterday. I was shocked to find out in the evening from this web that my face fat can be melted from this. I cried all night and all day today. I am 33 years old. Today my face is firm, but I read that Thermage and Pellevé are harmful. Can kill collagen and fat? I am so depressed. Please tell me, is it happening in every case? Is there a hope for me? What can I do to check the fat loss or to cure all this?
Thank you for your question. You're 33 years old. You had one Pellevé treatment. You stated in your question that your face feels firm, but then you did some research and you learned that Pellevé or Thermage could potentially cause loss of fat. And so now you're concerned that you may have done something harmful. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years, and I have had many different devices in my practice, both laser and radiofrequency. And I do have a lot of experience with dealing with the challenges that come with radiofrequency technology, particularly some more recent popular devices. I also, in full disclosure, I also have a laser device that does perform non-surgical fat reduction as well as skin tightening. So I can share with you a little bit about how we approach patients to help guide them as to what to do and what one device does versus another. So I think that one of the things that you are naturally concerned about is that there's now growing awareness that certain devices that were very aggressively promoted were being promoted to do non-surgical skin tightening. And it has been no secret from my perspective as I looked at the science of this, how limited a non-surgical device can be for skin tightening. The reality is ultimately is that there is a science behind how the principles of non-surgical skin tightening, non-surgical collagen stimulation, as well as non-surgical fat reduction. Patient selection is critically important. The judgment of the practitioner is critically important. One thing that I have tremendous issue with is when any procedure is done by a non-physician or where a physician's assessment has not been done in person, I think that there's always going to be risk for problems. When it comes to radiofrequency devices, the question of is it possible is always going to be, the answer is always yes. In medicine, if it's possible, if it's occurred, then it is possible. However, in my experience, the use of Pellevé, which is a very slow, progressive elevation of skin temperature to a critical level, is less likely to cause this type of fat loss, this undesirable fat loss, when compared to a type of device which suddenly heats up the skin at a very high level. We have a particular device, a Fotona laser, that we're able to use to do non-surgical skin tightening, and there is a protocol in which a certain amount of time and temperature has to be achieved with the goal of skin tightening versus the application with the goal of fat reduction. Which means that if you are considering any of these treatments, if a doctor evaluates you and decides, well, let's say, for argument's sake, under the neck, if you have extra fat, well, then you want to do something that does fat reduction. And if you want, and you have loose skin, you want something that tightens the skin. Customization is critical. I think for a 33-year-old woman with one Pellevé treatment, the chances of any significant fat loss is unlikely. It takes a while to achieve a critical temperature, and it is not likely, in my experience, that Pellevé would cause you to lose fat. It's very important you discuss with your provider, and hopefully it's a physician, to learn about the risks of fat loss. We are helping a lot of patients who have had fat loss, who have had various types of thermal devices elsewhere by using platelet-rich plasma and other regenerative medicine techniques to try to stimulate their collagen and stimulate the fat, because fat is an important part of a youthful skin quality. So again, I think it's important that you not panic, but speak to the provider, hopefully again as a physician. Ask about the science, ask about how to distinguish the methodologies to ensure that you get the benefit with minimal risk of the loss of fat. So I hope that was helpful. I wish you the best of luck, and thank you for your question.